your total protein intake should be around 80 to 100 grams per day. So if you have diabetes or if you have history of gout, you can taper that down maybe to about 60 or 80 grams. But if you don't have diabetes that is bad, or if you've never had a history of gout, then you should be okay with 80 to 100 grams of protein. Now, there are many proteins variety. Of course, natural occurring proteins in meats, fish, chicken, turkey, that's great. You want to have your meals and have your proteins in your meals. And we always tell patients, when you're sitting at a meal, you eat the protein component first. So if you're having roast chicken and let's say carrot and rice, you eat the chicken first before you get to the carrot or the salad, and then finally the rice or the pasta. But between your meals, you want to start getting the routine established that you drink a protein shake, a whey-based protein ideally, and you want to sip on that over the course of the day. Okay, you don't want to get a bullet and drink it over 10 minutes because you absolutely hate it and you just do it and run. So the idea is to find one that you like. There's many varieties out there, and so you've got to go test them out. Don't go buy a big bucket full of protein powders and then after 3 or 4 days you're done with it because you hate the smell, the taste. You want to buy small amounts and keep making sure that you test new things. And the one that you like, you stay with for a while as long as you can, and you sip on it. Mary pointed this out. You know, you get bored of these things. So the challenge is in finding one that you like and keep staying with some protein between your meals. One between breakfast and lunch, one between lunch and dinner, and that way you end the day with a good 80 to 100 grams of protein, 12 to 1400 calories, and then together with your exercise routine, you will see that you will lose 10, 15, maybe 20 pounds. And the higher your start weight, often the more you will end up losing. And it is easier to lose, I have to say. If you're at 200 pounds, it's hard to lose 20 pounds. If you're at 300 pounds, it's a lot easier to lose 20 pounds. So you want to aim towards a good 5 or 10% weight loss. And that will allow a number of things. First of all, the upper abdomen thins, which makes access to the abdomen easier. Inside the abdomen, the fat pads thin, the liver thins, so you can put the instruments in easier. You can actually have a better chance of finishing the surgery laparoscopically, and better outcomes. Because if you do the operation open, big incision from breastbone down to the belly button, a lot of pain, slower recovery, potentially higher complication rates with bleeding, infection, wound breakdown, hematomas, seromas, fluid collection in the wound, and hernias. So you want to avoid all that. So one of the things that you're doing right now in losing that weight is to maximize your chance at getting the surgery completed laparoscopically.